Welcome back to Against the Grain. My name is Dr. Samir Kakodkar. I'm a gastroenterologist and specialist in ulcerative colitis and Crohn's disease. Today, I had the pleasure of interviewing Joshua Bradley, who overcame a severe case of fistulizing Crohn's disease using a combination of conventional methods, ketogenic diet, endurance exercise, and supplements, which were guided by biohacking. That is, he used objective data from testing to help determine what was working for him. I found our discussion regarding how food affected his microbiome analysis to be particularly interesting. As a disclaimer, this is not an endorsement or recommendation of any of the methods discussed in this podcast, and this is not medical advice. The particular tests mentioned in this interview are not FDA approved and are lacking in evidence to support clinical validity. That is, the ability to measure or detect a clinical condition or predict a health outcome. You can also contact me in case you have any questions about this podcast, or if you'd like to make an appointment to see me. My email is samir3@gmail.com. So today we have Joshua Bradley, who has a very inspiring story about how he overcame Crohn's disease. And it seems like he's done a lot of research, tried a lot of different treatments, and ultimately came up with a regimen that was successful for him. So I like to have people who have these kind of stories on the show so that we can see how, ultimately everybody's different as far as how they respond to things. But it seems like he found something that worked for him, and maybe this can be a springboard for research in the future, and also just to help open people's minds up to some of the alternative treatments that most conventional physicians are not currently aware of. So, Joshua, thanks for being on.
Yeah, thanks for having me.
So, I think it's probably best just to start with taking us through your Crohn's diagnosis and kind of what were some of the conventional treatments that you started out with.
Yeah, so in 2012, I got really sick, and it wasn't really clear what was happening. It ended up taking several months before any kind of diagnosis happened, but I lost 90 pounds in 3 months, and they couldn't really stop it. They couldn't really figure out what was going on. And then my doctor at the time ended up doing a test. I'm trying to remember the name of it's one of the few tests that they'll actually do to sort of try to suss out inflammatory bowel disease. But anyways, the test went to this lab in Arizona and came back. And at the time I was diagnosed with ulcerative colitis. But one of the things that was kind of out there was that my inflammation levels were so high in the test that they ended up sending a representative from the lab to my doctor's office in Oregon, and to find out if I was like a real human, and whether or not I was actually being treated. And so at that time I had CRP levels over 200. So it was kind of like I had this inflammation curve that was just off the charts. And even after the diagnosis, it took quite a while before they were able to kind of get things under control. And ultimately it came down to just stop the inflammation cycle, came down to a lot of prednisone and cortisone. And we can sort of talk more about that. But the sort of lead up to it was really pretty extreme. And, like most things, if you look backwards in time, coming from a place now of knowing what was going on, there were signs probably at least a year or two in advance of this that had somebody picked up on those, we probably could have avoided the sort of cascade that happened after that.
Right. Yeah, I mean, there's something that I've observed and tends to be true is, once inflammation starts going, that process starts, and the more you leave it kind of unchecked, the more difficult it is to control later on, as opposed to getting on top of it from the beginning. But I wonder what was going on. Why were they having so much trouble figuring out that it was inflammatory bowel disease? Was it just that you were losing weight and not having any other bowel symptoms? Because nowadays, I feel like if someone's losing weight and they have any kind of bowel symptoms, they end up getting scoped, endoscopies. So I'm not sure what was the reason for the delay in the diagnosis.
It's hard for me to know. It's been, to some level, it's kind of a bit of a source of frustration and thinking back of just like, why were people not paying attention to some of these things? Mm-hmm. There was clearly something going on bowel related. Like, I was in the bathroom 30 plus times a day. We ran a lot of tests. I'm not sure why it didn't lead to, inflammatory bowel disease faster. Mm-hmm. But I can tell you, at one point, one of the comments from one of the doctors was like, well, how much weight do you want to lose? Okay. And it's like, well, that's not really the approach I'm looking for. Okay. So it's hard for me to know. And then I would also just say on that, like, I was obviously like really, really sick. I had lost a ton of weight. I was, pretty septic. And the further into that it got, the more affected everything was, meaning that my thinking wasn't particularly clear. And the people that were sort of advocating for me in my life, my fiance and family members and stuff, didn't really know what to do at all either. And so, I think my recollection, particularly at the peak of that, gets really fuzzy because my experience of what was happening and what other people tell me now, what was going on around me, were very different things. So, when you get to that level of sickness, like your own cognitive function is obviously compromised as well.
Sure. Okay, so you mentioned you were put on steroids for a long time, and I don't want to dwell too much on the medications and the management that you were on as before that wasn't successful, but just briefly, if you can just go over like what other medications were tried and ultimately didn't work.
Mesalamine ended up being the thing that kind of did something. Like, nothing really was working at all. And I should say that the disease presented itself, and again, probably due to some of the extreme inflammation levels. Like, so I went from, I was not just having sort of bowel issues, but ultimately what happened was I would kind of get a little bit better with some of the medication stuff that we were working with. And I was still on a lot of prednisone just to get the inflammation down to semi-normal levels. Like, it was a lot. And so, but I would like get sick again. And even with all of these interventions, so what happened was, it turned out that I had also a bunch of fistulas that for some reason they weren't aware of, even though I had been scoped. And then they went in they finally found a couple of them. They went in to address those, and then they found a cavity the size of a softball in my left butt cheek. And so that was causing a lot of the sepsis problems that I was continuing to have. And then they did an emergency colectomy. They loop colostomy with the intention that they were going to put it back together, but they disconnected my colon so that they could deal with the fistulas. And so I slid pretty quickly from, kind of in the sort of bathroom presentation of the disease into all of these other, like, really, not totally obscure side effects, but like complications that were probably due to, again, the prolonged level of inflammation that I was dealing with. Mm-hmm. And so, in those surgeries, like that was even before we really even got to like medication to control the Crohn's. Like it went really quick. So the first from, let's see, 2012 started in July. We didn't really get a handle on just solving, knocking down the inflammation until December. So it was going into 2013. By 2014, I had surgery, this emergency surgery, and at that point, they were like, "We can't help you here. You need to go to a bigger place. You need to go to a bigger city where there's better resources." I was living in Ashland, Oregon, little town, Southern Oregon, and they wanted me to go to Portland, and I didn't really want to go to Portland, so we came south, and I ended up getting into Stanford, which was another story in and of itself. But my disease was like, people just hadn't seen the stuff that was happening to me, at least where I was at.
Yeah. And what year was this? Also, just to get some context of what kind of medications were available at the time. What year was this?
It was 2012. Was when it started, and a couple of the medications that they tried earlier on just made me sick. I'm not sure why we didn't end up in some more kind of infusion. Like Remicade is. I've been on Remicade now for about 2 years, which was more effective than sort of the pill form stuff that I was taking.
Yeah.
But yeah, I think some of it was just where I was at. The medical knowledge around all this stuff just wasn't there.
Right.
And at least they had the sense enough to say, like, you need to find some place that can take care of you a little better than what we could.
Yeah.
But that,
that makes sense. And just to go back to the, your presentation with fistulas, and I'm assuming you had mostly colonic disease. Is that right? Was your colon involved, and then you had the fistulas, like perianal fistulas? Is that right?
Yeah, and there was a debate sort of back and forth all along about, the diagnosis of Crohn's versus ulcerative colitis. Ultimately, doctors settled on Crohn's because of the fistulizing. Right. Even though I've never presented anything outside of the large intestine. Yeah. So it was all colon. And yeah, it seems like there may be now even some research into like an expansion of maybe like another presenting type that sounded a little more like what I had, with really high inflammation levels, fistulizing, mostly colon based. But for me, it didn't really matter what you called it,
Right. But whenever you present with fistulas, and I would agree, I would call it Crohn's because ulcerative colitis does not present with fistulas, and it's actually not uncommon to have Crohn's in the colon, just in the colon with perianal disease. So I know we think of Crohn's as the terminal ileum and the colon, or the terminal ileum by itself, but just colonic Crohn's is not necessarily uncommon. And nowadays with that kind of presentation, we usually are pretty aggressive with medical therapy because the fistulizing phenotype that's like automatically severe for us. So we end up doing combination therapy. Usually the best studied medication combination in the context of fistulizing Crohn's disease is both Remicade because that has been proven in a randomized controlled trial to improve fistulas, and that's the only medicine to date that's really been studied in a randomized controlled trial to actually improve fistulas, and that was the Ascend-2 trial. But we tend to be pretty aggressive using Remicade, and usually in combination with another medicine like Imuran.
With methotrexate or?
Yeah. I mean, usually you do Imuran, but methotrexate is also an option too. Right. And that just helps to boost the level of Remicade and also decrease the risk of forming antibodies to Remicade?
Yeah, and with me, I had some sort of like genetic issues that may actually create more of a problem with the methotrexate, and so this kind of perceived maybe 10% boost that we got from it was didn't really sort of outweigh the potential for issues.
Okay.
And I had such sensitivities to other medications that it kind of like it didn't seem like it would really be the best choice.
Okay.
So I've only I've had Remicade, but without the methotrexate.
Okay. Yeah, I mean, there is some newer data that suggests. Actually, my mentor, who I worked with, Dr. Hanauer, had done a study looking back at a very famous study called the SONIC trial, which is a randomized controlled trial looking at people with Crohn's disease and comparing Imuran by itself versus Remicade by itself versus the combination. And also, so that trial, when they looked at the actual drug levels in people with the combination therapy, like that, the main finding from that trial was that using combination therapy has higher success rates than using just Imuran or just Remicade alone. But then when they look back retrospectively through the data, they found that it really correlated with the drug level and not necessarily if they were on both drugs at the same time. So it's all about the drug level. So you can get that drug level up without using Imuran by just adjusting the dose of the drug itself, like doing it more frequently or a higher dose of the Remicade. So and
that's what we ended up with me as well. So we were finding, the sort of normal 8-week cycle for the Remicade. Like I was essentially like already processing out of the medication. So I actually do every 5 weeks.
Okay.
And that also, made that part of the treatment far more effective.
Great. Okay. So you got some success from Remicade, sounds like, but was it just not getting you quite to where you wanted to be?
Yeah. So I've dealt with fistulas throughout this entire process, even while on the Remicade. And then I had this kind of temporary ostomy that I ended up having for 3 years because I had moved in different environments and figuring out how to fix it and whether we were going to go to permanent or they were going to actually try to put me back together. So I had this kind of like, this thing that wasn't intended to be permanent in a kind of semi-permanent basis.
Right. And let me just explain that to the audience who may be confused about the anatomy. So it sounds like you probably had a loop ileostomy, which means they take part of your small bowel and almost kind of like split it in two and bring both.
It was a colostomy.
Oh, it was a colostomy.
It was a colostomy, yeah.
A colostomy, then that means they just diverted part of your fecal like they pretty much then split the colon in two, brought one end to the abdominal wall, and then the other end was just a blind end to it. So you had a colostomy. Go ahead.
Yeah, so it was looped. So the idea was, they'd heal the part going down, to the anus, and then put me back together, and things would be grand. And the doctors at Stanford were really very compassionate and letting me kind of head down that road until we didn't get to that point again. Now, so how the sort of Remicade fits in and what I was actually trying to achieve was some of that. So the original thing was I want to get healed enough that we can put me back together. That was kind of the ultimate goal. But also there was this kind of lingering issue with inflammation. So, but symptomatically I wasn't really presenting anymore, but I was still, I still had inflammation that was much higher than anybody wanted to see. I was dealing with energy issues and just being sick. So even though I wasn't, having sort of the bathroom problems associated with the Crohn's, I was having the autoimmunity kind of spillover became more of the challenge, and the Remicade wasn't really addressing that component of it.
Sure. And that is one of our treatment goals. Now, in the past, we used to treat inflammatory bowel disease just targeting symptoms, but we know that symptoms don't correlate well with what the actual inflammation looks like inside. And it's that inflammation in the bowel that leads to the long-term complications of strictures, fistulas, requiring surgery. So our goals now, it's called this kind of treat to target strategy, where we use whatever treatment we're using. Our goal is to normalize inflammation if we can. Now, we're not able to do that, and actually the majority of people with just medical therapy alone, maybe about 30 to 40% of people can get to like complete healing of the colon in the context of Crohn's disease, colon or small bowel. But unfortunately, the vast majority of people, we can't quite get there, so we do the best that we can.
Yeah. Yeah, and at the time, so I had about, what they considered about 80% of my colon, had pretty active disease. My goal again was to try to give it some time to heal up with the therapies that we were working on, with the idea of being able to get put back together. We sort of actually went to reach that point, meaning that we arrived at a point where we thought that was actually going to be possible. And we were preparing for the surgery to put me back together, and discovered that there was essentially a stricture in the lower half that just made it impassable. There, the whole kind of lower part of the colon going down was just closed off, and so that obviously changed the decision completely.
Yeah. Okay.
And yeah, and who knows how long that had been the case? It's hard to say. But by the time I had my permanent surgery, I had healed. I had kind of reversed that trend, and so I had about 20% of my colon had some active disease in it, and most of that was right around where the ostomy site was itself.
Okay.
So we had come a long way, it was a really difficult decision, but it was the only one that made any sense at that point.
Okay. So what happened from there then? So you had improved on some medical therapy to some degree, but still not feeling perfect, may still have some ongoing smoldering inflammation. And now there's a stricture or a narrowing in the diverted part of the colon, so they can't reconnect you. So what happens from here?
Yeah, that was kind of a low point. The whole situation around that decision was really hard for me to wrap my head around, because, treatment and studies and, what we're able to do with this has changed so much just since I got sick, which was not all that long ago. And the idea of doing something permanent seemed like it was a really difficult decision to make, because I felt like, well, in 5 years we could have a totally different understanding of what was going on, and
yeah.
But now I don't have that option anymore. So that was that was probably the hardest component for me to wrap my head around, and that's how I ended up getting on the bike, because I essentially was sort of sliding into depression, and feeling like I didn't have a lot of agency, and I just felt like I needed to do something that I felt like I could train to do reasonably, give myself a goal and have a reasonable chance of meeting that goal, just to, like, again, kind of reclaim some sort of agency in my life and feel pretty good about things. And as it turned out, that particular decision is what ended up reversing, like, all of this stuff, because it probably physiologically forced my body to figure some stuff out, but it also dove me into a bunch of areas of research in order to, like, figure out, well, how can I do this if I'm really not feeling well? The combination of those two things, kind of being in that darkest place, is ultimately what led to, like, where I am now. And had I just gone along with kind of the medical treatment as it was kind of being laid out, and even had the surgery at that time, I don't think that I would be in the state of health that I am currently. And those changes were really where I started to make difference in the inflammation in particular and the autoimmune response.
Okay. So let's go over some of the details of kind of what happened from there, as far as what things you added to your regimen. So my understanding is you stayed on Remicade. Is that right? You stayed on that?
Yeah, I still am currently.
Okay. But in addition to that, you did some adjunctive things. So take us through that, kind of the evolution of that, and how you came to add new things and how those things came into your life.
Okay. So I had been kind of exploring intermittent fasting and ketosis primarily as a way to, just reduce the load on my body and try to increase the amount of energy that I had available to me. So I'd been, I had been sort of fat adapting, I guess would be the best term, for a couple of years in this process. And the effects that I was feeling from that energetically was kind of leading me in a bunch of different directions. So I was looking at things genetically, epigenetically. I was interested in the microbiome, obviously, and I became really interested in mitochondrial health. And that came from kind of a functional medicine approach of, if your cells aren't healthy and they're not producing new healthy cells, then it's really hard to get a handle on all of the other stuff that's going on. Meaning that if the kind of upstream cellular health is damaged, then, you can be doing all the things that you want to try to fix your gut. But ultimately you're just in a recursive path. Like at some point you have to be able to kind of heal these other processes that are happening. And so I became focused on those things, and that was kind of all wrapped up as well in the cycling, because if you don't have the energy and health to really be pushing yourself, like, how do you get that? And ketosis became a real important component of that for me. With the bike. So it's kind of simultaneously, like, trying to figure out, okay, how do I essentially be an athlete when I'm really sick, and I have these problems, and what are the pathways to get there? And then I'd had, kind of this illumination around sort of cellular health and at a mitochondrial level. So I became kind of focused in those areas, and found some genetic defects that were probably causing some problems at a methylation level. So I started to kind of address those things, instead of just kind of looking at like how do I fix leaky gut, or kind of the more sort of gut focused treatments, or dietary focused treatments that most people are doing.
Mm-hmm. So how did you figure out, like, what testing did you do to figure out these genetic issues that you came up with?
So I did the 23andMe, and then there are a number of tools online, and I kind of did them all that would run, essentially like health profiles against, the 23andMe raw data that you could download. Mm-hmm. Prometheus and Genetic Genie was another one, and that was all actually a little overwhelming, because once you kind of see where those patterns are and you don't really know what you're looking at, it kind of just looks like it's almost like looking at the worst version of yourself, in the sense of like, oh my gosh, like there's all these things wrong with me. Of course I'm sick. Okay. So I had to, it really did kind of look like, all this makes sense now. I have a 2-copy MTHFR gene issue. So, right off the bat, I've got some methylation challenges and being able to process folates and stuff like that, which is going to cause a lot of downstream effects. But I also have some mutations in other genes that are associated with stress and causing cascades in that way. And so, I had to kind of step away from the sort of DNA aspects of things and look more at like kind of the epigenetic expression of those. So how can we address these, within the context of toxic loads and environments and stress and stuff like that? Because if you just dive into it by yourself, it's really overwhelming.
Yeah, I can imagine. That is the danger of kind of interpreting medical tests that are not necessarily officially approved to, lead to decision making regarding your health. So stuff like 23andMe and genetic profiles, you may have your genetics may be somewhat different from the vast majority of people, but does that necessarily mean it translates to disease, or that particular right. genetic difference is actually expressed, or is this just junk DNA that's not really, doesn't mean anything? It's very difficult to tease that all out, especially if you're not like a geneticist or really know what even if I were to look at that kind of information, it'd be very difficult to figure out if that's meaningful or not. But
yeah, and some of these reports too, like not to point out in specific, but some of these reports will like give you this thing of like, well, here's all the stuff you need to take to balance out all of these problems, right? But it's like 5 pages of things. And it's like there's no way you're gonna do all of that stuff. Right. Even if you could afford it, you're just not going to be able to take all of that. And so I really tried to focus on like the things that seemed to make the most sense. And I would also say, just on the genetic front, like, we're still trying to figure out where inflammatory bowel disease gets expressed in the genes. And, there's been like maybe 50 kind of gene expressions associated with Crohn's, and there's some of them that you can test and stuff like that. But I actually don't really come up with any sort of DNA mutations that are associated with Crohn's. They all come back kind of normal.
Right.
And so it's easy to get lost in those things. But there are some things that I think are really actionable. And I think actually Dr. Ben Lynch's work with the dirty genes stuff is probably the most useful in terms of interpreting maybe some mutations that you have, because he's really kind of going to like a food focus as much as possible, and supporting kind of top level issues, again, like the MTHFR mutation. Like that's like a really real thing that you can address pretty simply with some supplementation and nutrient approach that could really have an impact on a lot of other things. And so that, again, it was like kind of taking a step back and like, okay, what can I actually address out of this, and how do those things relate to me now? Again, with the stress management, I mean, really early on in this process and in the research into Crohn's, it became clear to me, and autoimmune disease in general, became clear that stress is like the X factor, like all other things being equal. If you, almost everybody dealing with autoimmune is probably dealing with an issue around maybe stress or anxiety management. And the points at which you flare up are often the points at which those things are peaking. And certainly in my case of what was happening in my life when all this presented, I was kind of at maximum stress levels. Mm-hmm. And so that, again, is a really easy thing to target in the sense of like, there's this information. What can you do in order to really like have a material impact on your own health? Stress management is probably at the top of that list for me. And again, kind of early on, I had discovered a study that was done in India on a pretty wide variety of people with inflammatory bowel disease. And at the end of it, the thing that stuck out the most to me was that the people that they went back to 10 years later that were not affected symptomatically by the treatments that they had were all, the one thing that they all had in common was that they were continuing this yoga practice that was part of some of the groups in the study. And the people that did the yoga practice presented far less symptoms and life disruption than the other folks. And so again, like that was just signaling to me that there's this component that's really important, which is your mindset and the environment that you're putting yourself in, and how you're responding to the environment that you're putting yourself in. And so stress management and doing things to support that, both in the food and supplementation and practices like yoga or meditation, became kind of like my top level.
Okay. Yeah. About stress, I mean, I said this on a prior podcast that, I've seen patients who do feel like stress contributes, and they feel like there was a lot of stress around the time they were diagnosed. But there's also other people who say, yeah, stress has no influence on, like when they were diagnosed, there really wasn't a particularly stressful time, and they don't correlate stress with the flares. So, but I think it's possible everybody's different, and everybody can have a different response to stress. Also, people can sometimes bury stress and not really admit to actually having it or even recognizing that it's going on, and it could be going on at a low level. And I also think stress can indirectly influence disease by making you do other things that can, like you can have a poor diet because you're stressed out, or
right.
you may not sleep as well. You may have a disrupted circadian rhythm. You may not go outside as much. You may not exercise as much. And maybe it's not the stress itself per se, but the secondary effects of being stressed out.
Yeah, and stress is kind of a funny topic too, because it's actually kind of covering a really wide range of experiences, right? So in the context of this cycling, like I decided that I was going to, ride this 50-mile Gran Fondo, and I had 6 weeks to do it. I had a temporary ostomy that was herniated and prolapsed at the time. I had active fistulas. I had a CRP that was like in the 30s and 30 to 40. I had a really elevated SED rate. Like I was not particularly well, and yet I was forcing and I bought a single speed bike, so I didn't have any gears even, but yet I was pushing myself on a pretty. I've figured out like, okay, in 6 weeks to do this 50 miles, here are the things that I have to do to achieve that, and I was just going out and doing it. Now that in and of itself is a stress, right? Like the stress on my body, the mental stress maybe of putting all of that together, the training aspects, the being sick while doing it. So yeah, I get that when I'm saying stress, like it's kind of an umbrella topic. And I think that there's a lot of really great data and some really solid books and research out there on the positive effects of stress on your life. But some of it is how you're all relating to all of that in the world. For me, when I was really sick and felt like I couldn't, like this was just happening and there wasn't really much I could do about it, I really wanted to feel like I was going to come out the other side of whatever this process was with all of the gifts. Like, I'm going to have all the negative effects of what I'm going to feel and being sick and how it's going to impact my family. Like, that's all going to happen. There's not much that I can do about it, other than, do my best to address, and be compliant with what the doctors were wanting. But the one thing that I could control was my experience of it, meaning that, like, how did I want to be in this, and how did I want to treat the people that was around me? How did I want to feel myself? And I wanted to kind of, whatever this transformation was leading me to, I wanted to feel at the end of it like there were really positive things out of this process. And I did that. I made that decision kind of pretty early on. And so also throughout this process, I was trying to find those. I was actively looking for those things as well.
So ultimately, I know we started talking about this, your diet. So you settled on ketogenic diet. And what was the basis of that decision? And let me just describe what that diet is for people who may not be familiar. A ketogenic is a very low carb and tends to be a high fat diet. Initially was used for seizure disorders, and that was kind of the first clinical indication for that diet, but since then has become very popular for weight loss. I don't see too many people using it specifically for autoimmune disease. I'm sure there are, but definitely within the context of inflammatory bowel disease, it's not a popular choice. I see people doing specific carbohydrate diet for the most part, or there's other diets like the Maker's diet. Some people go vegan, some people go paleo, but particularly ketogenic is relatively unique.
Low FODMAP and
right. Low FODMAP has been studied in the context of more irritable bowel syndrome, but and also in the context of IBS in patients with inflammatory bowel disease. Not any data that it helps decrease inflammation. So what made you go for the ketogenic?
Well, it really came down to, a couple of things. One was energy production, because I was really pushing my body pretty hard, and I was not, particularly energetic, because I was pretty sick. And so the at least the feeling of energy and maybe even some cognitive clarity that you get kind of from having a high level of ketones in the blood really became this kind of like X factor for me. Like I can feel more energetic than I actually believe myself to be because of this process. And then the other, I think, component of it was like, I don't know if other people feel this way that have inflammatory bowel disease, but like, I just don't want to eat a lot. Like,
okay. Yeah.
Like the more you put in, the more ultimately is going to come out. And having kind of moved into some intermittent fasting and a higher fat, lower carb diet meant overall that my body was processing less. Like my active digestion was far, was reduced just from that component of itself. I also, just from that experiment, and I experimented both with nutritional ketosis, which I think is really difficult, and we can sort of talk about how I feel about that now, kind of retrospectively. But I was also adding exogenous ketones into my diet, and that was kind of like the cheat, in the sense of I was giving my body, ketone, beta hydroxybutyrate, that your body can use immediately as energy. So it was, it wouldn't be all that different than drinking more caffeine so that you stay awake more, in the sense of how I was using it. But I really kind of got experimental into the exogenous ketones, and I would say the reason why I kind of kept going was because for the first time I was starting to see a dramatic decrease in my inflammation levels. Like nothing had ever really knocked it down in a consistent way, but the ketones and the ketogenic diet was really making an impact, and that to me seemed worth following the thread.
So the ketogenic diet that you followed, I'm just trying to kind of contrast it with the specific carbohydrate diet, which tends to be something that's definitely not necessarily a low carb diet. It tends to be, but you can still eat a ton of like bananas or fruit, and still it would be like a normal, maybe even you can even make it a high carbohydrate diet. But it also is really strict about processed foods and food additives and things like that.
Yeah.
Are you strict about that stuff, or will you eat something like that's high fat, that's something processed, like something that comes in a box or like a wrapper? And are you reading food labels and making sure that?
Yeah, I don't really eat much of anything that comes in a box at all.
Okay.
In the kind of the difference in that between the specific carbohydrate and where I was at with the ketogenic diet, like I didn't feel good eating fruit in general. It just didn't make me feel good, and so not having a lot of sort of carbohydrate sugar in the form of sugar was relatively easy for me to accomplish because I just didn't feel well. Okay. I didn't feel well eating dairy. And that was something that was really early on very clear. I was gluten-free. I think that there's enough evidence out there that people that are dealing with autoimmunity, that should be like probably on the list of things you should not be doing is eating wheat and gluten. So I had already kind of reduced a lot of the carbs, and corn. Again, I think the connection between glyphosate and the deterioration of the epithelial layer and the gut lining is becoming clearer and clearer, and it's really hard to know where those things are coming from, but they're almost all coming from grains. So for the most part, I cut grains completely out of my diet, other than rice, and even then it's pretty much just jasmine rice. It's the easiest to digest. But my ketogenic diet, I was able, because of the further you go into sort of fat adaptation, where your body is preferring to use fat as a fuel as opposed to carbohydrates as a fuel, like the more and the more exercise you're doing, the more tolerance you have to how many carbs you can actually eat, right? Mm-hmm. And so it seemed like as long as I stayed around under 50 grams of carb, which is still pretty low for most people, and most of that was coming from vegetables, and I keep my fiber content down to about half of what like an average diet would be, I was feeling really good. I was able to stay in ketosis. I was kind of boosting that with, exogenous ketones. And that was kind of really key. And I think that that for an intervention, a strict ketogenic diet, even down to maybe 20 grams of carbs a day, from an intervention, it can be really powerful. I mean, I can see, I have all this data, like 4 years going back, of being able to look at, where these things impacted, particularly my inflammation levels. And I can see where those points happen. And, but I don't think it's long-term. It's really hard to comply with. I also think long-term that if you have gut problems, you're probably going to run into more of them if you stay that strict in your carbohydrates, because we need prebiotic foods to keep your gut lining healthy. And most people on a ketogenic diet are not eating prebiotic foods. So I kind of ended up moving into what I consider I guess I'd call it a slow carb, high fat diet, where I'm consuming things that are high in kind of resistant starch, and polysaccharides, which are not part of the specific carbohydrate diet. Right. Because I think they're important to gut health. And I have some microbiome data, again, going back over like 4 or 5 years, that shows the impact of doing that on my microbiome. And so,
oh, interesting. So did you use Ubiome or which?
Yeah, I use Ubiome.
Okay, so you had a profile done before changing, like what?
I have like 30 or 40 different tests with them now, going back to 2014.
That's interesting. Okay, so you kind of did this N=1 trial, your own trial of your microbiome, and seeing how different foods affected your profile?
Yeah, and so along this time, I've been tracking like 100% of my food for the same period of time. I track a number of sort of health markers in both glucose and ketones tracking. I've got data, a lot of data, obviously, from blood work. So I've been able to kind of match these things together and say, between this point and this point, here are the things that changed when I started doing X. Yeah. Here's what the result was. And then if I go back and do something else, I can see if that changed. And so I was really kind of driving my own interventions based on the data that I was seeing. And that's kind of evolved into this diet. And, with the microbiome stuff, probiotics become such a big component of what everybody's, what a lot of the sort of dietary treatment is. But I was not seeing an impact in the probiotics in my microbiome, and that became like a source of question for me of like, okay, so what's the deal? Like, I've been on, a variety of most of the ones that people would associate with, and prescription level VSLD number 3. And, some of those things, you feel better taking them. Like it may, create some better feelings in your stomach, but I wasn't seeing it in the actual biome. And the things that were making a difference with the microbiome in specific were coming from foods, and they were coming from prebiotic rich foods, and again, things that I'm both eating that are high naturally, and then things that I'm doing to convert other foods like rice and potatoes to increase the amount of prebiotic resistant starch. Those things, as well as a particular coconut yogurt that's got a really clear profile of the bacterial strains that were in there. Uh-huh. I have like really clear data from that of like eating essentially that for a week, along with a juice diet of mostly vegetable juice, not essentially getting almost all of my bulk calories from this coconut yogurt with the probiotic strains, and like the only real impactful jump in the microbiome readings out of that. So,
what's the brand of that yogurt?
It's called Earth Organics.
Okay. Yeah, so what you're mentioning is really very interesting, because I think a lot of people get caught into traps when they're trying to figure out lifestyle interventions or diets or alternative therapies, as far as finding ones that work for them. And sometimes you can get caught into a trap of continuously doing something even though it doesn't work. And sometimes you can treat things like their religion or their gospel, and you stick to them even though you're not getting where you want to get to, and you're not bold enough to sometimes let go of certain things and start to try other things. And I truly believe in that you kind of have to be very flexible. You know, like I'm not sure if you're familiar with, like, Bruce Lee used to say, you know, you have to be like water. You have to flow like water. You have to try different things, see what works for you, and you have to be strong enough to let go of things, even though if they make sense. Like, there's a lot of things out there that make sense on paper. Like, the mechanism is there. It makes sense why it would work, but you try it on yourself and it doesn't work. And then in your mind, it's like, oh, should I just keep doing it? Maybe it's just going to take some more time, or maybe I'm doing it wrong. I got to tweak it a little bit. So it's a very complicated process. But ultimately, I think what you did, because everybody's different, right? Like, there could be some diet protocol that helps a handful of people, but when you try it, it doesn't work on you. And I really do believe everybody's different. Although, just take Crohn's disease, the Crohn's disease that you have versus the Crohn's disease that somebody else has that doesn't have fistulas and is affecting their small bowel, I actually think they're completely two different diseases. We just call it under the same umbrella. So what may work for one person does not necessarily work for everyone. But what you did is very interesting, and I think is along the way that medicine should be practiced in the future, is that things are tried and then you're tracking your own data. This isn't some randomized controlled trial where you get, you know, hundreds or thousands of people that try one intervention, and you only can declare if it works if it's statistically significantly better than placebo. What you're doing is taking things that make sense, you know, like theoretically makes sense that they could work, as long as there's not much of a downside to them or not any real serious side effects. And you're doing them and you're tracking your own data and seeing what happens, seeing how you feel, tracking inflammation, objective markers of what's going on, and making decisions based on that. And I think that's really the smartest way to go about things. However, one caveat, just to play devil's advocate on your approach, the ubiome is, you know, I'm assuming they checked your stool to get these profiles, and there's been some controversy, because I've also done microbiome research on diet, and there is controversy on if the stool profile accurately represents what the microbiome is actually at the mucosa of the colon. Like, is the what's coming out in the stool different from the mucosal microbiome? And there is data to suggest it is different. So,
I would agree with that. And I would say that the two most useful things that I've gotten out of the microbiome testing, one is there was some data that said, you know, essentially, like, you can increase the diversity of your microbiome just by being outside, like exercising outside.
Right.
And I actually have that data. Like, I actually can see that in my own microbiome, increase the diversity by 20%. And just, you know, from doing this training outdoors. And so I think that, like, we know that having a more diverse microbiome is going to make you a healthier person, right? But, like, that seems to be pretty correlative at this point. And so if being outside more makes that happen, and doing some exercise where you're doing some heavy breathing outside, you know, makes that better, I think that's a really easy thing to do that's going to have a lot of downstream effects. And the other part of that, I think, is in the the sort of probiotic or the prebiotic rich foods with a probiotic environment, in that I don't think you can count on at this point, if we get into like maybe some of the RNA testing in the microbiome, you're going to see a lot more specificity of like what's actually living. So I'm totally like agree, like going out and doing a bunch of microbiome testing is not really going to help you get necessarily better.
It's expensive too. I'm sure
it is, yeah. And although, with the smart gut test now, if you buy them, if you've got some insurance, like you can get it essentially for free. And they give you a lot more information. And now they're testing for yeasts and, potential pathogens and things like that, which is far more useful than it was when they started.
Yeah. So can you tell us what, from your analysis, what are these prebiotic foods that you found have made a difference in your profile and that you regularly use now?
Cooked and cooled potatoes probably have the biggest visible impact in the microbiome changes.
What's the significance? What kind of potatoes? Are these sweet potatoes or just regular?
Potatoes. I do eat sweet potatoes, not a whole lot, and I don't necessarily eat a lot of potatoes, but I do try to get some in on a semi-regular basis. But the process of cooking and cooling a potato converts the carbohydrates into starch, and the starch is not not digestible, so that's the prebiotic starch. And it's quick. It's a lot too. So if you cook a potato, put it in the fridge overnight, and then eat it the next day, about half of those carbohydrates have been converted into starch. If you do it again, if you heat it up again and put it back in the fridge and get it the next day, like 75 to 80% of those carbohydrates have been converted into prebiotic starch. So it's just like people that are into resistant starch are buying like potato starch and eating that. And you can do that, but it's not very good. Like, I don't like to do it. So I'd much rather start with a whole food and do that. I don't eat potatoes a whole bunch, but they're the ones that have made the kind of biggest visible impact in the data. I do it more with rice, and again, it's a similar thing. There was some really great research that's come out in the last couple of years, showed that if you added a little bit of fat, like coconut oil or something, to the rice when you cook it, cool it in the fridge, the next day, about half of those carbohydrates have been converted to resistant starch. And so I consume rice probably 3 or 4 times a week. That's usually cooked and cooled.
Do you have to eat it cooled, or you can warm it up?
No, you can heat it back up, and it still retains its. Okay. It still retains it once you heat it.
And you do jasmine rice? You said, right? You don't do brown rice?
No, jasmine rice is essentially the most digested. It's the easiest rice to digest.
Because my understanding was that white rice is almost completely absorbed in the small bowel. I mean, but you did see that rice did have an effect on the microbiome profile?
Yeah, but again, when it's converted, if you're just eating it, if you're just eating it, hot right after you cook it, you're not going to get those benefits.
So you cook it, you put it in the fridge, which is, I think most, at least, I'm Indian, and Indian people eat a lot of rice, and they tend to cook it in excess. So a lot of times they do end up making some, storing some in the fridge, warming it up later on. So, so that converts some of it to resistant starch.
About half. I mean, it's pretty significant. I also eat green banana, so plantains, green banana flour you can buy and like make stuff with it. So I'll do that.
Okay. Wow, what you're saying is completely antithetical to the SCD.
It is.
But that doesn't matter, right? It's like your data is what's important, not what's in a book or, like that. I totally agree with this approach on an individual basis. I mean, if it's helping you, then you should do it.
Well, and I would say, too, with diet, and I've said this along, you can eat the best food, at the wrong time, and it's not the best food for you. You can eat maybe not the best food, but it's it's sometime when you need it. There are times where we just need comfort from things.
Yeah.
And it may not be the best thing for you to eat, but, maybe it is for other reasons. And so also, we're on a time continuum all the time. Your body today is not the same as your body tomorrow. There's stuff changing and happening all the time.
Right.
And so to some degree, having some level of flexibility about what you're doing is really important. I would also say just in I think the specific carbohydrate diet can be really useful for people. And again, I think as an intervention, it can be incredibly powerful. Mm-hmm. I think in terms of long term, the polysaccharides are necessary for our body to maintain a healthy mucosal layer in the gut. And I think that there's, enough scientific data out there to show if you starve yourself of those things, then that layer becomes more fragile. And there's a lot of ways to potentially either get that as well. There's a recent study that just came out about the impact of cordyceps on the gut lining. And I've been taking cordyceps for a while as part of a different kind of regimen. But or things that are high in beta glucans, like other kinds of mushrooms, have a real effect on the gut layer. So I think anything that you're going to do for a really long time that doesn't take into effect the mucosal health in your gut is going to cause problems. Or at least perpetuate, maybe not get you to a place where you feel like you're on top of it. I kind of woke up out of this process based on a couple of other interventions post-surgery that, when I finally did wrap all this stuff down, I kind of woke up an athlete, and it wasn't expected at all. But I was shooting for something else. I wasn't shooting to be on a specific diet forever. I wasn't shooting to, not be symptomatic. I was actually trying to solve this kind of bigger autoimmune puzzle of myself. I wasn't trying to solve it for anybody else. Yeah. But I looked at myself and said, nobody else is going to be able to give the attention and focus needed to fix this. But I have that time because I was so sick I couldn't do anything else.
Yeah. Yeah. No, I mean, I think what you're describing is really going to be the future of medicine for many people who can't get answers or who can't get completely well with conventional methods, and they have to kind of go off the grid and figure out what works with them. And it's kind of taking a gamble because not everybody can find something that works. I mean, you can try everything under the sun, and some people you're just not going to come to an answer that's you're going to be satisfied with. But clearly, some people do. So that brings me to there's one more thing I wanted to ask you about is with the intermittent fasting thing. Now, I had an episode 2 episodes ago. I spoke to a guy who claimed to cure his Crohn's by fasting for a month, completely just drinking herbal teas and water for a whole month. And then when he came back he didn't go back to a completely normal diet, but he went back to a relatively healthy diet, not too restricted, and pretty much didn't come back. But he says he thought that the real mechanism behind the fasting as far as helping with the Crohn's was he came to more of a spiritual awakening. Like he realized a lot of the things in his life that he had to fix as far as how he was leading his life, and that's ultimately why he thinks he improved from that experience. But I've tried intermittent fasting. I've tried time-restricted eating. Ultimately, I have concerns about it because, first of all, I didn't really notice it made much of a difference, that by itself. And secondly, I was losing weight, significant weight, as I was doing that. And then it became pretty, like it was just too much weight that I was losing while doing this. So I wanted to ask you, were you underweight before you started doing these things, or were you more like normal or potentially overweight? And then what have these interventions done as far as your weight? And are you at like a healthy weight?
Yeah. So when I first got sick, I was overweight, which actually I think, again, kind of in retrospective, was probably inflammation related.
Yeah.
And then what's interesting was I got down, I was like 140 something pounds. I came back up a little bit, in the cycle of steroid stuff, and eventually kind of settled out around what people would consider probably underweight for my size. I'm about 5'8", and I was about 152 pounds when I was doing most of these things. And I actually, my weight was really stable. Like I didn't drop. I wasn't dropping weight doing any of these things. I was getting a lot of calories from fat. I also was doing a lot of things to sort of, boy, it feels like we get to the top of these like really big topics, right? But let me see if I can just answer your question without digging too far deeper into the topic. But okay. I didn't experience any kind of weight loss, and actually, what I found was I seemed to be getting healthier at the same weight. Meaning, like I can show you pictures of myself at the same weight that I am now, and I look totally different. And so that all becomes about nutrient, right? Like the amount of nutrients that your body is able to process. And like I at the same weight sick than I am now, I'm not the same person. I was tracking all of my food. I was making up a lot of stuff with supplementation. I think amino acid and protein synthesis is also a really big issue, particularly for anybody with gut problems, because you're probably just not synthesizing protein the way you need to be. And so I was supplementing a lot with amino acids, again, based on some of the testing that I did, organics acids test, as well as a SpectraCell analysis. Those things, I think for anybody that feels like their disease is a black box that they don't know inside of, one or both of those tests can open up that black box and show you things that maybe you never knew were going on, and maybe even give you some really simple things to try to rebalance them out. So I think that those were totally a game changer. But the amino acids, again, like even now, I just did a triathlon, my first triathlon, and then my training partner and I rode back to Santa Cruz from that triathlon, which was 100 miles. So in all of the time, the calories out from the thermogenesis of that process was like 7 or 8, maybe 9,000 calories. Like I did most of that entire thing fasted, and with some fat. And my total caloric intake for the day was, around 2,000 calories. I didn't lose any weight, that didn't sort of come back, maybe water weight. But I guess the point that I'm trying to get at is that if you're giving yourself, if your body's getting the nutrients that it needs, and you're giving yourself the fuel in order to do whatever it is that you're doing, whether it's athletic or just your daily needs, the time-restricted feeding or intermittent fasting really shouldn't have a huge swing for you.
Mm-hmm. Okay. Yeah. I mean, I was doing that along with, I still have this in my regimen, but I run about 3 miles every other day. It's obviously not to the degree of endurance exercise you're doing, but for me, that seems to be the sweet spot. And I try to do it. My preference is to do it outside as opposed to indoors. I try to get as much sun exposure as I can. Like I take off my shirt.
Yeah.
That's what I've been doing, and I was doing that along with restricting my eating to a window of from about 1 or 2 p.m. until about 7:30, 8 p.m. And then I realized how much food I do eat normally after 8 p.m., and I was just cutting that out. And I'd lost about 10 pounds over the course of 2 weeks doing that. So and I'm on SCD. For the most part, I do SCD, but over the years I've kind of expanded it. Like I do eat actually fermented rice. So there's certain Indian food that is fermented rice, like it's called dosa or idli. This is South Indian food. So that's kind of has been my regimen. But I didn't really see much benefit from the fasting as far as the symptoms. Maybe a little bit of a benefit. But I'm very interested in the whole like prolonged fasting, like we're eating nothing for 3-4 weeks, like that one guest that I had on. Obviously, I caution against that to anybody right now until that's further researched. But that's an interesting concept.
Yeah, and I think this goes back to the cellular health thing that I was talking about before, which is the fasting. Whether it's fasting mimicking or actual fasting, is going to kick off autophagy, right? Which is the cells, essentially dumping the garbage. And I think this is an important component. It's an important component for staying healthy in general, like irrespective of your disease state. But I think that's part of where that gets kicked off, like going back to like you have to have healthy mitochondria, you have to have healthy energy production, you have to have healthy RNA reproduction in order for to recover from anything, right? And so if you're addressing the kind of sort of mitochondrial level health upstream of your disease state is really important. Because again, you could just be chasing gut problems forever. Like you could just be chasing leaky gut, or, I know people that have got other issues that aren't associated, with bowel stuff, but, they're chasing kind of the same problems over and over again. And if you go back and start to address some of the cellular health stuff, those things may, start to loosen up, and then you're not chasing down the symptoms so much anymore. And I think that there's a lot of, particularly around inflammation, there's a lot of stuff around CoQ10 with PQQ, addressing inflammation. Reversitrol, addressing inflammation, and antioxidants. If you've got a lot of oxidative stress, you're going to have a lot of inflammation, and so I kind of think like the inflammation is sort of the lever that gets into whatever the chink in your armor is. If the chink in your armor happens to be inflammatory bowel disease, then the inflammation is going to be what kicks that off, right? If your chink in the armor is more, coronary related, the inflammation is going to kick those off. But if you can start to address the inflammation kind of at a cellular level, you may experience less suffering from the other components that you're dealing with.
Sure. So, before we wrap things up here, because I think we're running a little bit above overtime, and that's fine. I think we're having a really interesting, going really deep on these topics. So, just one thing I wanted to mention and I always like to give the other perspective on what any guest I have on. If you mention something that's kind of at odds with conventional medicine, I at least like to mention it, not because I'm being difficult or I'm saying whatever approach you're trying is wrong. I'm just trying to give a perspective of what the traditional gastroenterologist will say.
Yeah.
So that people who are listening, who potentially will bring this stuff up to their doctor, they'll know what to expect. But these tests, these labs that do these tests, that a lot of integrative medicine or functional medicine doctors use, like, for example, I think one of them is Genovo or Medinet. I'm forgetting the exact names of these, but you're probably more familiar with them. But they're not like FDA-approved lab centers. It's not like Quest Labs or the labs that you can get through your doctor's office or in the hospital, right? So if you end up getting these tests done and you go and they show some abnormality, like I've had them done myself too, a lot of these. Not the specific ones, but I definitely did Genovo. I've done like the Ubiome. I've done a few other blood tests and a urine-based one too. And it did say that certain pathways were off and that you could potentially supplement with, like, I think it told me to take some sort of amino acid. I'm blanking on it. I think it was taurine or something like that. I had tried it for a little bit. I didn't really notice much of a difference. But if you bring this to your doctor's office, first of all, they're not going to know what the hell they're looking at. That's number one. And number two, they're automatically going to assume that data is not valid because it's not in a validated lab, it's not FDA approved, and also any intervention that they're recommending has not been studied either. Like, is that really, maybe they do see some pathway that's not completely normal as far as, they measure different cellular pathways, right? And if they see that certain products there's not enough of, or there's a buildup of a certain, they'll recommend a certain intervention. That intervention has not been proven to lead to better health outcomes. But at the same time, I'm not sure people are actually studying this formally. And so it's just like kind of an unknown. So yeah, I just wanted to put that caveat out there that not everyone believes that this testing and the interventions that are done as a result of these testing lead to actual improved health outcomes. And I definitely know that's true within the context of inflammatory bowel disease. I don't think it's been studied, really. And you mentioned mitochondrial health. And this is something I've been reading a lot about over the last couple of years. And it is a hot topic amongst functional medicine, integrative medicine doctors, as far as optimizing that. And it seems like they recommend certain nutritional supplements, antioxidants. Some people go as far as saying that, sun is very important for mitochondrial health and exercise, and but that's not on anybody's radar when it comes to inflammatory bowel disease. I actually looked into this. I don't think there's any studies looking at mitochondrial health with regard to these diseases, like looking at the mitochondria, for example, in colonocytes, like the cells in your colon or the cells in your bowel, and how healthy they are, and are they different from people who don't have the disease. And then even if you found that there was some abnormality, the question is, is that the actual cause, or is that a consequence of whatever other stimulus or trigger that is leading to this disease? So it gets very messy, it gets very complicated. But what specific things do you do for your mitochondria that you've studied or that has been recommended to you?
Well, I'd like to acknowledge what you're saying, because
Sure.
I mean, I've experienced this as well, and luckily my gastroenterologist again has been really sort of. I've been incredibly compliant with him, and that has kind of created a relationship where he's also then open to the things that I'm doing, and I'm really upfront about a lot of that stuff. And then bringing him the results of those things as well. But at the same time, I'm being really compliant with what he's telling me. And I think that this is an important thing, whether we're talking about diet, whether we're talking about interventions, whether we're talking about medical treatments, and again, the infusions and that kind of stuff. I mean, one of the most common questions I get is like, well, where you're at now, are you going to stop taking the Remicade? And not until, my doctor and I agree that it's an okay thing to do.
Right.
Because I've nearly died a few times in this process, and I realize the gravity of what it is that I'm messing around with, and so it's just not worth it to me,
right.
To take those chances. But the thing is that if you're not compliant on anything, I actually think that whether it's a lifestyle change or a diet change or medication, if you take something positive, so like a vegan diet, and you just did that really consistently and for a long enough period of time to see an impact, like not a couple of weeks, but probably like 3 to 6 months of doing something consistently, you'll probably see a net benefit effect from where you were, because you're probably eliminating a bunch of other things that were not that healthy for you, right? And so I think that compliance, just in general, to an approach is really important, both for medication and a diet. Doing a ketogenic diet for a couple of weeks isn't going to help anything, even for a month. Fat adaptation can take a month to 2 months just for your body to kick in. So, but we're often looking for really quick kind of, resolutions to things, and that's not usually how things work. You need some compliance, and you need to do it over a long enough period of time, and find some things to measure that you can say, like, okay, this is actually different than it was before.
Right.
So I just wanted to say that, I'm taking in all that I can get that I think will be of benefit, and then I'm deferring to people that are smarter than me in all kinds of areas, and having a conversation with all of them about what I'm finding, what I'm doing, and the results that I'm having. And what you get in that case is a team of people that all are contributing to your health, and I think that is really, really important. So in terms of some of the things that I'm doing, and the other thing that I wanted to say is, while these things are definitely not being looked at for inflammatory bowel disease, and I've gotten into this discussion around the ketogenic diet and its impact for inflammatory bowel disease, because I think people should be studying it, because I think it can have a real impact. But what people are studying these things for are against inflammation, particularly if you get into anti-aging. So if you want to not think about mitochondrial health, because I don't want to think about the mitochondria, I don't want to think about the powerhouse of the cell. Look at anti-aging research, because that's the same thing. We're talking about healthy cells that are not dying off too early, that are reproducing, healthy, full of energy. You've got a healthy energy Krebs cycle working, and the impact of those things on inflammation, that research is happening all over the place, and the impact of things like ketones and the ketogenic diet on inflammation, that's happening. And so there is data. It's just at this kind of top layer stream, nobody's bringing it down necessarily to your gut. But if you can get your inflammation levels normalized you're probably going to start to affect those other things as well. So that's kind of where I went with some of this, is like, okay, well, like, none of this is happening in a vacuum. Like, it's all connected. So if I've got high oxidative stress, or if I've got low, omega-3, in my body, I've got like a ratio of omega-6 to omega-3 that's off, and I don't have very high EPA or DHA levels. I can probably be relatively assured that by balancing those things out, I'm probably going to have a net benefit increase of my health, which is going to, impact my disease state. And so those are the things that I was looking at. Like, there's some pretty significant data, I think, showing the impacts of things like CoQ10 and PQQ, which often gets combined with CoQ10 at this point into products. And their impact on cellular health, inflammation, even inflammation related in the bowel. There is some of that stuff happening. So that's kind of that's one of the ones that I've definitely seen an impact. I take CoQ10 with PQQ and a Shilajit, which is like fulvic acid. It makes all of that sort of more bioavailable. I take a fish oil for the same reasons. Only I actually have seen a real impact on the mucosal layer on my ostomy, based on the type of fish oil that I'm actually taking. Okay. And so rather than optimizing for like the highest omega-3, I'm actually looking at like the highest quality fish oil. And so there are a couple of those that absolutely make a complete difference in the mucosal layer on my ostomy than other types. And so again, like, I know that works. I'm going to take it because that mucosal layer is everything. So I'm talking about, like, I've taken some pretty popular brand, like high omega-3 stuff, and my mucosal layer is kind of watery. I can switch to a fish oil brand. One I'm taking right now is actually from Primal Kitchen, from Primal, Mark Sisson's company. Mm-hmm. He's got a pretty high purity fish oil that's like a real fish oil. It's not extracting all these other components out of it. And the mucosal layer on my ostomy changes. It's sticky. And there's another one that's a Alaskan salmon that's from Trident, and they got into trouble because of claims around omega-3s and stuff like that. Or not in trouble, but people were like claiming their levels of omegas weren't as high as they should be or whatever. But the actual fish oil itself, it's not rancid. If you bite into it, it's really fresh. So yeah, that one is something that I take all the time, and has a lot of effects that are going to be benefit your inflammation, your oxidative stress, that kind of stuff. I don't know. I know we're running long on time here.
Yeah.
I have one anecdotal story that I think is probably worth telling.
Sure.
Because again, it's kind of looking at sort of meta problems, which is when I had my permanent surgery, I had a whole bunch of complications afterwards, that I spent most of 2017 in Stanford in my surgeon's office every day, where she was taking care of me, because we just couldn't get things to heal up. It had gone on for 4 or 5 months, and I said, look, we need to fix this. Like, I can't be in here all the time. And I had been having some conversations with a friend of mine who's a health researcher, and he was researching Ehlers-Danlos syndrome and RCCX, which is both of those are dealing with like essentially extracellular matrix, the collagen kind of like holding everything together in our bodies. And we were noticing some kind of parallels between where I was, the things that I was experiencing, some hyper joint mobility stuff, and looking at how those things are being addressed. And so I took kind of a distillation of these things, and I told my doctors, look, I'm going to be instituting miraculous healing mode. We're going to have this wrapped up in a month, and we're going to solve this. And my miraculous healing mode was based on a bunch of this research coming from other areas, but it was all really around protein synthesis, like getting your body to synthesize protein so it can generate new tissue. Because that's what was not happening, and that's one of the things that gets broken, particularly in Crohn's. It's one of the areas that people struggle with, is building muscle mass, gaining weight, protein synthesis stuff. So I combined a product called Aquamin, which is a blue-green, or it's a red algae powder that is high in a lot of trace minerals, MAP amino acids, and then I was eating like 100 grams of protein or more per day. And I did those three things, and in a month, everything reversed. It was everything that I'd say. It had all completely reversed. Everything healed up, and my surgeons asked me to write down this protocol so that they could give it to other patients. I got another colonoscopy, and my GI doctor said, like, in his notes, there was no active disease, and everything was consistent with Crohn's remission. And we'd like completely turned things around. It was totally unexpected for him. I had to have kind of another minor surgery to fix some of the abdominal wall stuff. And I added glutamine to that mix as well. Glutamine, again, is, it's one of the amino acids that we use to build tissue, right?
Right.
Everybody was really nervous because of the previous surgery and the complications that we had. But it healed up within, like half the amount of time that everybody had expected. But not only that, so I healed all this tissue, which was causing a problem, and had been a problem for me for my entire disease state, was the breakdown of tissue, right? And around the fistulizing and all that kind of stuff. But with the attention to the amino acids, a mineral, trace mineral, high source of that was high in trace minerals, and getting enough protein into my body, my inflammation levels went down like a whole other step function down, and my CRPs right now at 0.2 as of the last. I'd been hovering at 10. I had gotten down to about 8 with and 4 with the ketogenic stuff and adding the ketones and the exercise into my regimen. And then this last component like dropped everything down into like what's considered normal levels. So right now, for the last few months, all my inflammation levels normalize. My hemoglobin's starting to normalize, and my iron levels have started to normalize. It's been a really dramatic change. So the moral of that, or the component of that story that I'm trying to convey is that I'm a really big believer in particular of amino acid. It's a really easy thing to take. It's cheap. it can have an impact. And if you combine that, just paying attention to your protein intake and the amino acids that you're giving your body can make a really big difference.
What was the name of that product you said? It was Aquamin seaweed?
It's Aquamin. It's AQUAMIN. And It comes in a powder form, and it's a red algae from like Europe.
And then you said MAP amino acids?
Yeah, so there's the MAP amino, it's master amino pattern. The idea behind it is that your body has amino acids in different levels. Like we don't have the same level of each amino acid. They're like we have different amounts of each.
Yeah.
The MAP amino is essentially mapped to the way your body, the percentages of each amino acid, essentially amino acid that your body produces. So it's at the same level. So the idea is that it's supposed to be more bioavailable. There's a few brands out there that are doing the master amino pattern, the MAP aminos.
Okay.
I've recently been using a company called Fundaminos, Fundaminos, and it's a vegan source as well, which is important for some people. And I've liked that product quite a bit. And again, it's pretty affordable and it tastes all right. It has some other things in it that are, may or may not be helpful, but overall, I found that product to be pretty good.
Okay, that's very interesting. So it looks like that they did a colonoscopy. Just to wrap up, I think we'll take just maybe 5 more minutes. But just to get to the conclusion of your story, it seems like they did did they do a colonoscopy through your ostomy, or was it of the distal colon that's not in continuity with the rest of your bowel?
No, they did it through the ostomy.
Ostomy. Yeah,
and at this point, I've got that. The rest of my bowel has been removed.
Okay.
Below. I mean, they ended up taking out just that whole lower part, and plus like another 3 centimeters or something like that above where the temporary ostomy was, and then they created an ostomy, a stoma from that. Okay.
So, and then you're still on the Remicade, and you're still doing ketogenic and some of these supplements. Is that right?
Yeah, and again, my diet, I wouldn't really say I have times when I'm in ketosis, and I think this is part of the issue with keto right now is that keto is like a lifestyle, ketogenic is like a diet, ketones are in your blood. There's just a lot of vocabulary and semantics that kind of are important, but ketosis is the state of having a lot of ketones or having ketones above a certain level in your blood. So I'm often in ketosis, but I'm not really doing a really high ketogenic or a really strict ketogenic diet. Again, I would describe it more like a slow carb, high fat diet. I'm getting about 60% of my dietary stuff from fat, 20% on average from protein, and the rest from carbohydrates. And those carbohydrates are almost exclusively vegetables, potatoes that have been cooked and cooled on occasion, rice that's been cooked and cooled on occasion. So that's how I would describe my diet now.
Okay. Well, I'm happy that things have healed up. Seems like your colonoscopy is healed up. Your inflammation has come down it has normalized. So that's great. I mean, your approach is generally what I recommend to most patients I see as kind of like a combination of medication and certain lifestyle interventions that, I talk to patients in clinic and kind of get a sense of what their personality is like, what they're most willing to be able to integrate into their lifestyle realistically. And I think for everybody it's different. Everybody requires different combinations of different things, and I'm glad you came up with something that ultimately worked, and it seems like you're still continuing to experiment, continuing to try to optimize your regimen, which I think having that quality where you're kind of almost like a perfectionist and trying to always improve things, ultimately those people end up doing better, as opposed to just like kind of sitting back and hoping that certain medications will work. And although there is a substantial proportion of people who do get better on medicine itself, but there are people who don't get quite where they want to get with medicine or don't have any response to medicine at all. And that's when they kind of look elsewhere and kind of have to experiment. So it's just interesting to see your journey. And obviously you've done a lot of research and also biohacking. You've definitely kind of epitomized that term. You've really looked into your body in multiple different ways and figured out and are continuing to experiment. And this whole biohacking movement is becoming more and more popular. So it'll be interesting to see where this all leads to, and to see if it eventually gets integrated into conventional medicine.
Yeah, I think so too. I think, kind of personalized health is certainly the direction that we're headed. And now that we have so many ways of kind of, maybe measuring some things and getting at some things that actually seem sort of actionable in a reasonable lifestyle, right? Where you're not having to spend like your entire life thinking about all of this stuff.
Right.
And I early on when I was talking with people that had Crohn's or knew people with Crohn's, it seemed like the people that sort of in some way embraced the transformation that was happening on whatever level you wanted to accept that, both sort of like whether it's dietary or, a lot of people just went into entirely different fields of like work that I had never heard of. But it seemed like the people that embraced it and embraced the sort of personal nature of it even, seemed to be the people that came out the other side like with a really meaningful life for them. Mm-hmm. And so that became like an important thing for me. And I think, again, everybody goes into this different, but something's going to have to change. Like you can't just do nothing because the disease can be really dangerous. So, inquiring how that affects your life, I think, is an important component of this.
Mm-hmm. Okay, great.
Thank you.
So how do you have like a website or a blog or anything that you'd like to plug?
You can find me. Most of the stuff that I've blogged about is on Medium, and I'm at AirJoshB, AirJoshB, on Twitter and on Medium, and you can find me there. I'm still thinking about like what I'm going to do next, because I've really spent like the last 6 years like just trying to be healthy and stay alive and that kind of stuff.
Well, why not just enjoy your health and maybe focus on something else for a while?
Yeah,
because I had the same thing. Like for me, I've probably spent the last 10 years. Maybe 9 or 10 years, just either focusing on my own health or my, training, because training for my career. I'm a gastroenterologist now, specialist in inflammatory bowel disease. So sometimes I have to force myself to say, hey, you don't always have to think about these things. Why don't you go do something that's a little bit different? Read a book, paint a picture, go do something completely that has nothing to do with IBD. Sometimes totally. I have to force myself to do that because my work is like 100% that, and then the regimen that I do also takes a lot of my day. But yeah, sometimes you got to step away from it and let go. And that can actually be quite therapeutic too.
It's true. And I have 4 teenage daughters that were all quite a bit younger when this started. And 2 of them are graduating from high school this year. And
Wow.
one of them's a sophomore in high school. And yeah, there's a lot of life out there to focus on that doesn't have anything to do with all of this stuff. And, even just the riding the bike and running and that kind of stuff is pretty liberating in that way. So I agree with you. Like, the not having to think about it is an incredible luxury at this point.
Yeah, I would enjoy it, definitely.
Yeah, thank you.
Okay, thanks, Josh. Thanks for your time. We all appreciated your story, and I hope your good health continues.
Great, thanks, man.